Happy Plastic Surgery Day. Today we have Dr. Vijay Langer. Welcome to our show, sir. What does a plastic surgeon do? Is it making a person plastic-like or is it purely cosmetic surgery?
Hey Millie, thanks very much for the Plastic Surgery Day wishes, and it is great to be back on your show. So indeed, what does a plastic surgeon do, you ask? A lot of patients of mine ask me the same. Indeed, a plastic surgeon treats the skin and all the organs covered by it, which means pretty much the whole human body from head to toe. And no, we don't make plastic out of our patients. In fact, the origin of plastic surgery has nothing to do with plastic. The plastic, as we know it to be, was invented only as late as 1862, whereas plastic surgery has been there for ages and times immemorial. In fact, our own Sushrut, the Indian father of surgery and indeed father of ancient plastic surgery, who lived from 800 BC to 700 BC, was the originator of plastic surgery. So plastic surgery, the term plastic surgery takes origin from the Greek word called plastikos, which means to form or to mold, and therefore it has nothing to do with the plastic that we know of, which is so common in our daily usage. Indeed, plastic surgery has two broad categories: reconstructive surgery and cosmetic surgery. Reconstructive surgery is all about improving the function of the patient in various forms, and cosmetic surgery is all about improving the appearance of the individual.
What is reconstructive surgery?
Reconstructive surgery is all about improving the function of the patient, particular organs, particular limbs, but essentially just the improvement of the function. So it entails a lot of procedures. Indeed, treatment of burns, both superficial burns which will heal on their own and deep burns which need to be cut out and covered with own skin. Craniofacial surgery, which entails remodeling children or babies or infants, their bones, facial bones, cranial bones, that means the skull bones, because the expanding brain can be retarded. It's not remodeled. This is a special type of problem which is called craniosynostosis, wherein the skull bones are fused early and therefore the brain development may be hampered and brain growth retardation may occur. Indeed, other congenital anomalies such as cleft lip and palate, which is done by us plastic surgeons. Hand anomalies, a lot of anomalies or deformities of the hand where the wrist, the elbows and even the fingers are deformed. Absence of thumbs, which thumb is recreated and reformed. Hand surgery in particular, hand surgery as in trauma of the hand, wherein all the small bones of the hand are reconstructed, reunited. And yes, orthopedic surgeons can do some hand surgery, but definitely the hand surgeon, especially a plastic surgeon, can do a very good job, because both the bones as well as the soft tissues of the hand can be treated well by the plastic surgeons. Indeed, microsurgery is a fine craft wherein small teeny weeny arteries and veins and nerves are sutured to each other with stitches which are thinner than our hair strands, and obviously this is done under a microscope or intense magnification, even under loop magnification. Cancer reconstruction, especially of the head and neck, wherein a lot of large tissues can be are removed by the cancer surgeon and are reconstructed by plastic surgeons. In particular, again, microsurgery, wherein the small tissues, small arteries and veins are rejoined to give good form and function, including breast reconstruction, wherein after mastectomy or removal of the breast can be reconstructed with abdominals, even skin from the flap from the back with breast implants and so on. Congenital anomalies, of course, I've talked of, including penile congenital anomalies such as hypospadias, wherein the opening of the urethra in children is placed at a different level where it actually should be. Trauma reconstruction is a big part of reconstructive surgery, wherein everybody feels that it is the orthopedic surgeon who does all the reconstruction, but they only fix the bones. The skin which is dead has to be removed by the plastic surgeon, and then it is reconstructed or recovered or covered again, especially over exposed bones and so on. So that's another part of reconstruction that can be done. So it is pretty much a lot of surgical procedures which can be done to improve the function of the body.
What is cosmetic surgery?
Cosmetic surgery is all about improving the appearance of the individual. So indeed, a good looking person walks in and wants to look better. So it can be both non-operative as well as operative. Non-operative also procedures such as Botox, fillers, thread lifts to simulate facelift or a neck lift for facial and neck rejuvenation, especially of the skin. Morpheus 8, which is a recent development, micro needling radiofrequency energy, as well as the platelet-rich plasma. Your own blood, the patient's own blood, is spun twice. The red blood cells are removed, and so are the white blood cells. And the third formed element, that is the platelet, which is very rich in growth factors, is used for something like which is called as vampire facial, for facial rejuvenation, and even for hair growth. Forma has also been used as a radiofrequency akin to hot stone massage, and for facial and neck rejuvenation. Indeed, surgical procedures such as hair transplant, which is also for the male as well as the female, hairline lowering surgery, forehead reduction, especially in the transgender population, especially male the gender is changed to female, brow and a forehead lift, rhinoplasty, upper and lower eyelid surgery for eyelid rejuvenation, which is called blepharoplasty, face and neck lift, lip reduction, and filling with own fat. Own fat can be used for a lot of areas, especially over facial rejuvenation as well as breast enlargement. Breast enlargement in the form of both fat as well as own fat, as well injections, as well as silicone implants, breast reduction, breast lift, male chest contouring in the form of gynecomastia treatment. So a lot of these young boys, adolescents, have problems with self-esteem because chest appears like the breast of a female, and the roundness, which may be because of the breast nodule, as well as the fat, can be removed, and a flat chest can be given, and indeed really helps with the self-esteem of the young man. The tummy tuck and liposuction, indeed mummy makeover and daddy do-overs, six-pack, abs, arm liposuction and brachioplasty, which is arm reduction, thigh lift and liposuction, calf remodeling, calf implants, and even liposuctions, hand rejuvenation in the form of with the fillers, dermal fillers, as well as own fat injections can be done to improve the aging of the hand. Brazilian butt lift, a procedure where in the buttocks of the patient is enlarged with own fat, which is harvested from various parts of the body and then injected back into the buttocks. And indeed, penile rejuvenation, that is penile lengthening and penile augmentation in the male, as well as cosmetic gynecology. These are areas which can be controversial, but they give a very good result with quality of life.
Does a plastic surgeon also treat wounds?
Yes, indeed. We treat all kinds of wounds. In fact, wounds of any sort, because of road traffic accident, home accident, burn wounds, burn accidents, cancer wounds which are caused because of cancer removal, and any type of a wound from head to toe should be ideally treated by a plastic surgeon, especially so even diabetic foot infections, especially the plastic surgeon should be a core member of that of the team that treats the patient. So indeed, wounds can be divided, classified into acute and chronic. Acute ones are the ones which follow trauma, especially over the face, and burns and so on. Within 24 hours, these facial wounds should be closed in a layered closure. So that means the depth will take the pressure off the superficial layers so as to allow the wound to be almost approximated edge to edge by the time the stitching of the skin is required. This is what is called as a layered closure, and indeed I've talked of this in a few videos of mine, and this is definitely the best scar. The scar will always be there after these wound closures, but it will be the best scar in the hands of a plastic surgeon. Other wounds of road traffic accidents and so on should be covered by 3 to 5 days, indeed, before the wound infection sets in. Having said that, if the chronic wounds, if the wounds have persisted for over 4 to 6 weeks and we've lost the advantage of closure of these wounds or coverage of these wounds in the acute phase by 24 hours to maybe 3 to 5 days, then we use a lot of specialized dressings with foam and calcium alginate and even negative pressure wound therapy. That is, it's a medical foam and a closed circuit which sucks the wound, the infection, and causes healthy granulation tissue, that is a pink look to the wound, so that the hostile environment of the wound is reduced and the body either heals itself, or we effect coverage in the form of own skin graft, or even tissues or skin flaps which are taken from the neighboring tissue. Also equally important in these wounds is your own fat or the patient's own fat injections. Even fat can improve the blood supply to the wound and effect or help in wound healing closure. And PRP, platelet-rich plasma, your own blood, again very rich in growth factors, can also be used for closure of and coverage of these chronic wounds.
Are burns or burn wounds treated by plastic surgeons?
Yes, of course. We are the burn specialists, and indeed, when all burn wounds should be treated by plastic surgeons, and when it is done the scarring is at a minimum, it is least cosmetically disfiguring, and even lives are saved. While I was in the Indian Army for 28 long and glorious years, we used to, with conviction and effectively, heal large burn wounds, and to the tune of 50 to 60, maybe occasionally 70% surface area burn wounds in these patients who would be otherwise critically ill. And in most burn centers across the country and a lot of centers in the world, they would have died, and we could, with a lot of effort, and it was a huge team effort which saved these patients, but we could do that. So what a plastic surgeon definitely knows about these burn wounds is to identify which is the superficial burn wound, which will heal on its own by 10 to 14 days almost magically, and the other deeper wounds which need to be cut out and covered with own skin in the form of skin grafts or neighboring flaps, but mainly skin grafts, which actually cause less cosmetic disfiguring and also help the body to counter the severe burn injury, and therefore save lives.
Is cosmetic surgery only for celebrities, actors, etc.?
No, definitely not. As our world moves towards enhancing our own appearance, everyone is entitled to and is very much capable of being treated by cosmetic surgery, both by non-operative and operative means, whatever is possible and whatever the patient wants. In fact, indeed the mantra is whatever you want, you will get, if you are motivated enough to understand the process and take the downtime, if any, in your stride. So it is not only affordable now, cosmetic surgery in general, but also is very, very gratifying. And for a, as I said, for a motivated individual, cosmetic surgery is indeed the answer to his or her prayers, and it is definitely within his or her grasp, and gives some amazing results. So not only is it for celebrities, but it is also very much affordable and within grasp of the common man and woman.